We support a young man called Callum who lives locally here in Craigmillar. We've supported him for about 2 years now, and over the last 8 or 9 months we've worked quite closely with Callum and his mum and his extended family and network to try a different way of providing support, and that has been through an individual service fund underneath the self-directed support legislation, which of course came about through the national agenda to integrate health and social care more, which has been great, and it's worked really, really well. I think the things that we and the council would say as well have been the most important learnings that have come from this process are about sharing decision making, sharing control over the budget, letting go a little bit, being more progressive in risk taking. And I think just having an open dialogue and being able to be open enough to try things a little differently and see how they can work, rather than, automatically shutting things down that may seem a little bit difficult or challenging or just hard to work out how to do.
Before you were 24-hour support 7 days a week,
yeah,
and then you moved up to this house and you're on 27 hours a week now support,
yeah.
which is a huge difference for you.
Where I was before, I had staff all the time and it just does me nothing, so...
Because you like your own space,
Yeah.
and there's a lot of things you do for yourself anyway. You don't need staff doing stuff for you, do you?
No, not at all.
You come back and forward on your own, don't you? You can do
Yeah.
your own thing.
Just do my thing, yeah.
Yeah, and you've got lots of activities that you've got
Yeah.
to keep you occupied.
Yeah. I like the team I've got now, because the team I had before was a nightmare. Doesn't listen to me or didn't do anything with me. Just locked doors all the time and follow me about, and I hated it.
Callum says, and he'll tell you himself, that he used to feel listened to but not heard, and now he feels heard, and I think that that's made a difference, and you can see it in the changes in him.
You got, as part of your individual service fund, you wanted to lose weight and for your general well-being, so you got a personal trainer.
He gets me going, arms, legs, mostly my tummy. I was quite a big guy, really big. I've lost about 3 stone over this one, so this is good. I'm quite proud of it, really proud of it. Got a six-pack again. I got a camera for last Christmas and I got a good eye for it, someone told me. So I thought I'll take it photography and try it and see how it works. Kind of like taking pictures of the ocean or sunsets. Well, I've got pals coming on Saturday, just like for a wee night out. Give me a snooker and that.
What's your wee business venture that you're setting up?
Washing cars. It's going to be one business. I'm really forward to that as well.
A huge step from where you were even 8 months ago.
Yeah.
Family can definitely see how much your self-esteem and your confidence has grown, and really proud of the things that you're looking forward to doing as well.
Yeah. Before it was a nightmare, now it's kind of changing to an adult.
Regularly we get together and we have a chat about how things are progressing, and they certainly are. The multidisciplinary teams from the NHS, social work, very much the Thistle at the very core of that. And the good thing about Thistle is they very much brought me on board. If you don't have the backup of families, it's not going to really go anywhere. And obviously Callum, Callum was so keen to move on, so keen to develop and be seen as a young adult in his own right. So yeah, we do all still meet regularly, we still evaluate what's happening and review it. And yeah, everything's great just now, so it's great.
Because of the changes that have happened with Callum and his support, he actually requires a lot less support. He used to have 24/7 support, a team with him all the time, and that was quite difficult for him because he doesn't like people in his space. He's been able to reduce that to 27 hours a week. The medication that he's on has greatly reduced over time, and the team are working towards helping him manage that himself. Callum and his mum Moira have been confident enough to actually go out and tell their story and talk to other people and talk to providers, go out and do wee events and things like that actually is sharing the learning that has come from this process. And I think that that's something that they're really proud of, and that's something that we are really proud of, because ultimately we want to be able to share this experience and help other people get the support that they need and be in control.